Hello everyone and welcome back to my channel. In this video, I will be discussing the symptoms and treatment options for liver disease. I will also be sharing some tips for preventing and factors for liver damage. I hope that this video is helpful for anyone who is suffering from liver disease or is interested in learning more about this common fact to avoid and prevent from liver damage. The liver is the largest internal organ in the human body and plays a vital role in various physiological processes. It is located in the upper right side of the abdomen, below the diaphragm, and is responsible for a wide range of functions that are essential for overall health and well-being. Some important functions of the liver include 1. Metabolism. The liver plays a central role in metabolism, including the breakdown and synthesis of proteins, carbohydrates, and fats. It helps regulate blood sugar levels, stores and releases glucose as needed, and produces bile to aid in digestion and absorption of fats. 2. Detoxification. The liver is responsible for detoxifying and removing harmful substances from the body, including drugs, alcohol, and toxins. It metabolizes and neutralizes these substances to make them less harmful and easier to eliminate. 3. Storage. The liver acts as a storage organ for essential nutrients, vitamins, and minerals. It stores glycogen, a form of glucose, vitamins A, D, E, and K, iron, and other nutrients for later use when needed by the body. 4. Protein synthesis. The liver produces important proteins, such as albumin, clotting factors, and enzymes, that are essential for maintaining proper functioning of the body. These proteins play roles in blood clotting, immune function, and various other physiological processes. 5. Cholesterol regulation. The liver helps regulate cholesterol levels in the body by producing and excreting cholesterol as needed. It also plays a role in the synthesis of bile acids, which are important for the digestion and absorption of fats. Overall, the liver performs numerous critical functions that are essential for survival and overall health. It is a highly complex and versatile organ that plays a central role in metabolism, detoxification, storage, and synthesis within the human body. Maintaining liver health is crucial for overall well-being and can be supported through a healthy lifestyle, proper nutrition, regular exercise, and avoidance of harmful substances. Liver disease can present with a wide range of symptoms, which can vary depending on the underlying cause, the stage of the disease, and individual factors. Some common symptoms of liver disease include 1. Fatigue and weakness. Feeling tired or fatigued, even with adequate rest, is a common symptom of liver disease due to the liver's role in energy metabolism. 2. Jaundice. Yellowing of the skin and whites of the eyes. Jaundice is a classic sign of liver disease caused by elevated levels of bilirubin in the blood. 3. Abdominal pain and swelling. Pain or discomfort in the upper right abdomen, bloating, or swelling can be indicative of liver inflammation or fluid buildup, ascites. 4. Nausea and vomiting. Digestive symptoms like nausea, vomiting, and loss of appetite can occur in liver disease, affecting food digestion and nutrient absorption. 5. Dark urine. Dark-colored urine may indicate liver disease, as bilirubin is excreted through urine, giving it a darker hue. 6. Pale-colored stools. Light-colored or clay-colored stools can result from inadequate bile flow due to liver dysfunction. 7. Itching. Pruritus, itching, can occur in liver disease due to the accumulation of bile salts under the skin. 8. Swelling in the legs and ankles. Fluid retention in the body, edema, can manifest as swelling in the legs and ankles and is a common symptom seen in advanced liver disease. 9. Bruising easily. Liver disease can affect blood clotting function, leading to easy bruising and prolonged bleeding. 10. Spider angiomas and other skin changes. Spider-like blood vessels on the skin, spider angiomas, skin redness or discoloration, and changes in skin texture may occur in certain types of liver disease. It's important to note that some individuals with liver disease may not experience noticeable symptoms in the early stages of the disease. Additionally, symptoms may overlap with other health conditions, making it essential to consult a healthcare provider for proper evaluation and diagnosis. If you are experiencing any concerning symptoms or have risk factors for liver disease, such as excessive alcohol consumption, viral hepatitis infection, or obesity, it's crucial to seek medical attention for a comprehensive evaluation and appropriate management. What are the factors for liver damage? There are several factors that can contribute to liver damage, including 1. Excessive alcohol consumption. Chronic alcohol abuse can lead to liver inflammation, fatty liver disease, cirrhosis, and ultimately liver failure. 2. Viral infections. Hepatitis B, hepatitis C, and other viral infections can lead to liver inflammation, scarring, and liver damage. 3. Non-alcoholic fatty liver disease, NAFLD. This condition is associated with obesity, diabetes, and other metabolic disorders, and can lead to liver inflammation, scarring, and cirrhosis. 4. Medications. Certain medications, such as acetaminophen, can cause liver damage when taken in excessive amounts or over a long period of time. 5. Toxins. Exposure to certain toxins, such as chemicals, drugs, and environmental pollutants, can damage the liver. 6. Autoimmune disorders. Conditions such as autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis can lead to inflammation and damage of the liver. 7. Genetic factors. Inherited liver diseases, such as hemochromatosis, Wilson's disease, and alpha-1 antitrypsin deficiency, can lead to liver damage. 9. Obesity. Being overweight or obese can increase the risk of developing fatty liver disease and other liver disorders. 10. Other medical conditions. Certain medical conditions, such as diabetes, high cholesterol, and high blood pressure, can also increase the risk of liver damage. Is there anything I can do to prevent liver damage if I have a genetic predisposition? While you may have a genetic predisposition to liver disease, there are still steps you can take to help prevent or reduce the risk of liver damage. Here are some tips. 1. Limit alcohol consumption. If you have a family history of liver disease, it's important to limit or avoid alcohol consumption as much as possible to reduce the strain on your liver. 2. Maintain a healthy weight. Being overweight or obese can increase the risk of fatty liver disease and other liver disorders. Eating a well-balanced diet and getting regular exercise can help maintain a healthy weight and reduce the risk of liver damage. 3. Avoid exposure to toxins. Be cautious of exposure to toxins in the environment, such as chemicals and pollutants, which can contribute to liver damage. Take precautions and protective measures when working with potentially harmful substances. 4. Take medications wisely. Be cautious with medications and only take them as prescribed by your healthcare provider. Avoid self-medicating or taking excessive amounts of certain medications that can be harmful to the liver. 5. Get vaccinated. If you have a genetic predisposition to viral hepatitis, such as hepatitis B or hepatitis C, consider getting vaccinated to prevent infection and reduce the risk of liver damage. 6. Manage other health conditions. If you have other medical conditions, such as diabetes, high cholesterol, or high blood pressure, work with your healthcare provider to manage these conditions effectively. Keeping these conditions under control can reduce the risk of liver damage. 7. Regular checkups. Regularly visit your healthcare provider for checkups and screenings to monitor your liver health and catch any potential issues early. It's important to work closely with your healthcare provider to develop a personalized plan for preventing liver damage based on your genetic predisposition and individual health needs. Is there anything specific I can eat to support my liver health? Yes, there are several foods that can support liver health and help promote optimal liver function. Including these foods in your diet can help reduce the risk of liver damage and support the overall health of your liver. Some of the best foods for liver health include: 1. Fatty fish. Fish high in omega-3 fatty acids such as salmon, mackerel, and sardines can help reduce inflammation and support liver function. 2. Leafy greens. Vegetables like spinach, kale, and collard greens are rich in antioxidants and fiber, which can help protect the liver and aid in detoxification. 3. Cruciferous vegetables. Vegetables like broccoli, Brussels sprouts, and cauliflower contain compounds that support liver detoxification and promote overall liver health. 4. Berries. Berries like blueberries, strawberries, and raspberries are high in antioxidants that can help reduce inflammation and protect liver cells. 5. Nuts and seeds. Nuts and seeds, such as walnuts, chia seeds, and flax seeds, are high in healthy fats and antioxidants that support liver health. 6. Turmeric. This spice contains a compound called curcumin, which has anti-inflammatory and antioxidant properties that can help protect the liver. 7. Green tea. Green tea is rich in antioxidants called catechins, which have been shown to improve liver function and reduce the risk of liver disease. 8. Olive oil. Olive oil is a healthy fat that can help reduce inflammation and support liver health. 9. Garlic. Garlic contains sulfur compounds that can help support liver detoxification and reduce inflammation. 10. Citrus fruits. Citrus fruits like lemons, oranges, and grapefruits are high in vitamin C and antioxidants that can help protect liver cells and aid in detoxification. In addition to incorporating these liver-supportive foods into your diet, it's also important to maintain a healthy lifestyle that includes regular exercise, staying hydrated, limiting alcohol consumption, avoiding smoking, and managing stress. Consult with a healthcare provider or a registered dietitian for personalized nutrition. Recommendations to support your liver health. Are there any specific recipes you recommend that include these liver-supportive foods? Certainly. Here are 2 recipes that include liver-supportive foods. 1. Baked salmon with roasted asparagus and quinoa salad. Ingredients: 2 salmon fillets, 1 bunch of asparagus, 1 cup of quinoa. Mixed greens: spinach, kale, arugula. Cherry tomatoes, halved. Sliced almonds. Lemon. Olive oil. Salt and pepper. Fresh dill, optional. Instructions. 1. Preheat the oven to 400 degrees Fahrenheit, 200 degrees Celsius. 2. Place the salmon fillets on a baking sheet lined with parchment paper. Drizzle with olive oil, lemon juice, salt, pepper, and fresh dill. 3. Wash and trim the asparagus, then place it on a separate baking sheet. Drizzle with olive oil, salt, and pepper. 4. Bake the salmon and asparagus in the preheated oven for about 15 to 20 minutes, or until the salmon is cooked through and the asparagus is tender. 5. While the salmon and asparagus are baking, cook the quinoa according to package instructions. 6. In a large bowl, combine cooked quinoa, mixed greens, cherry tomatoes, sliced almonds, and a dressing of olive oil and lemon juice. 7. Serve the baked salmon on a bed of quinoa salad with roasted asparagus on the side. 2. Green smoothie with spinach, kale, berries, and chia seeds. Ingredients: 1 cup spinach, 1 cup kale, half a cup mixed berries, blueberries, strawberries, raspberries, 1 tablespoon chia seeds, 1/2 banana, 1 cup almond milk or any milk. Ice cubes. Instructions. 1. In a blender, combine spinach, kale, mixed berries, chia seeds, banana, almond milk, and ice cubes. 2. Blend until smooth and creamy, adding more almond milk as needed to reach your desired consistency. 3. Pour into a glass and enjoy as a nutritious and liver-friendly smoothie. These recipes incorporate liver-supportive foods like salmon, leafy greens, berries, chia seeds, and healthy fats, providing a delicious and nutritious way to support liver health. Feel free to modify the recipes based on your preferences and dietary needs. What are the medicine and medication used while cure from liver disease? The treatment options for liver disease depend on the specific type and severity of the condition. In some cases, medication may be used to manage symptoms, slow down the progression of the disease, or treat underlying causes of liver damage. Some common medications used in the treatment of liver disease include: 1. Antiviral medications. Antiviral drugs are used to treat viral hepatitis infections, such as hepatitis B and C. These medications help reduce viral replication, control the spread of the virus, and prevent further damage to the liver. 2. Immunosuppressants. Immunosuppressive drugs may be prescribed to patients with autoimmune liver diseases, such as autoimmune hepatitis, to suppress the immune system's attack on the liver and reduce inflammation. 3. Ursodeoxycholic acid, UDCA. UDCA is a medication commonly used to treat primary biliary cholangitis, PBC, and other cholestatic liver diseases. It helps improve bile flow, reduce liver inflammation, and protect liver cells. 4. Corticosteroids. Corticosteroids may be prescribed to patients with inflammatory liver conditions, such as autoimmune hepatitis or liver inflammation. These medications help reduce inflammation and suppress the immune response in the liver. 5. Medications for complications. In cases where liver disease has progressed to advanced stages, medications may be used to manage complications such as fluid buildup, ascites, hepatic encephalopathy, or variceal bleeding. 6. Medications to manage symptoms. Depending on the specific symptoms of liver disease, medications may be prescribed to alleviate symptoms such as fatigue, itching, nausea, or pain. It's important to note that medication should always be prescribed and monitored by a healthcare provider, as some medications can have side effects or interactions with other drugs. In addition to medication, lifestyle changes, such as adopting a healthy diet, exercising regularly, avoiding alcohol and harmful substances, and maintaining a healthy weight, play a crucial role in managing liver disease and promoting liver health. It's essential to work closely with a healthcare provider to develop a personalized treatment plan that addresses your individual needs and health goals. Can you provide more details on the side effects of antiviral medications for hepatitis? Antiviral medications are commonly used in the treatment of viral hepatitis infections, such as hepatitis B and hepatitis C. While these medications can be effective in controlling the replication of the virus and slowing down the progression of the disease, they may also be associated with side effects. It's important to note that not all individuals will experience side effects, and the severity of side effects can vary from person to person. Some common side effects of antiviral medications for hepatitis may include: 1. Fatigue. Many antiviral medications can cause fatigue or increased feelings of tiredness as a side effect. 2. Nausea and gastrointestinal symptoms. Some individuals may experience nausea, vomiting, diarrhea, or other gastrointestinal issues while taking antiviral medications. 3. Headache. Headaches are a common side effect of certain antiviral medications. 4. Muscle or joint pain. Some people may experience muscle aches, joint pain, or stiffness as a side effect of antiviral medications. 5. Skin rash or itching. Skin reactions, such as rashes, itching, or hives, can occur in response to antiviral drugs. 6. Liver toxicity. In rare cases, antiviral medications can cause liver inflammation or liver toxicity, which may require close monitoring by a healthcare provider. 7. Changes in blood cell counts. Certain antiviral medications can affect blood cell counts, leading to anemia, neutropenia, low white blood cell count, or thrombocytopenia, low platelet count. 8. Mood changes. Some antiviral medications may cause changes in mood, including depression, anxiety, or irritability. It's important to discuss any potential side effects with your healthcare provider before starting antiviral medication for hepatitis. Your healthcare provider can help monitor for side effects, adjust your treatment plan if necessary, and provide guidance on managing any symptoms that arise. In some cases, the benefits of antiviral therapy may outweigh the potential side effects, especially in slowing the progression of liver disease and reducing the risk of complications. Always follow your healthcare provider's recommendations and inform them of any side effects or concerns you may have while taking antiviral medications for hepatitis. Thank you for watching, and don't forget to like and subscribe for more videos on health and wellness. Take care and see you in the next one.